Next up, we're going to be joined by Dr. Craig McDonald to share some recently reported updates from PTC Therapeutics comparing deflazacort and prednisone. So Craig, go ahead and take it away.
Well, thank you very much, Ryan, and I would like to really focus here. Could I see the first slide again? So again, what I'd like to do is present some recent data that we have looked at with regard to deflazacort versus prednisone. So what we've done recently is taken another look at some meta-analyses on some placebo-controlled data sets, where in the placebo groups, we actually were able to evaluate comparisons of patients in the placebo arms of clinical trials treated with Emflaza or deflazacort versus those who were treated with prednisone. As you are aware, deflazacort is the only corticosteroid approved specifically for Duchenne in the U.S. for patients aged 2 years and older. And thus far, a number of meta-analyses have supported the benefits of deflazacort over prednisone, looking at a number of clinical efficacy endpoints. And today we're going to actually revisit those meta-analyses looking at important subgroups of patients treated with these two medications while being in the placebo arms of various clinical trials. If we go to the next slide. Next slide, please. So again, the early initiation of corticosteroids have been shown to translate to better overall outcomes for Duchenne patients. So we believe that if steroids are started earlier in the course of the disease, there'll be better function and prolonged time to loss of very important milestones in a Duchenne population. Next slide. This is actual natural history data from the CTAP consortium, actually looking at the rise from supine time on the left and the North Star time, various trajectories. What you can see there on the left is that the horizontal line shows a 5-second rise time, and patients that are below a 5-second rise time actually have fairly stable functioning. They may actually be showing improved functioning, but fairly consistently, those with rise from the floor times of greater than 5 seconds has very precipitous declines in function. Similarly, on the right, those that are younger than age 7 to 8 years of age oftentimes are in a maturational trajectory where they're actually showing improved function on the North Star, but fairly consistently, those who are 8 years and older show decline on the North Star ambulatory assessment scale. So for this study, we actually were interested in looking at differences with treatment of deflazacort versus prednisone for patients who are above 5 seconds on the rise time or below 5 seconds and above the age of 8 and below the age of 8. Next slide, please. So as far as the objectives, they were to evaluate daily deflazacort versus daily prednisone in patients with Duchenne using data from the placebo arms of the two PTC trials, 007 and 020, and the Lilly Tadalafil trial, and to compare daily deflazacort and daily prednisone in key Duchenne patient subgroups. So those of baseline age of 4 to 8 to less than 8 years of age, and those who were greater than 8 years of age, and then also looking at those with time to stand from supine of less than 5 seconds versus those with a greater than 5-second rise time, and also those with previous corticosteroid treatment duration of 0 to 3 years versus those who were greater than 3 years. And I think these subgroups are certainly of interest because the 4DMD clinical trial, which has completed, we don't have the readout of the results yet, but that trial was largely conducted in patients who were 4 to 7 years of age, and those patients were followed up for a total of 3 years. So we're really asking the question, as to whether there's differences with deflazacort and prednisone in patients who are more progressed with regard to their disease severity and older. Next slide, please. So we actually had a lot of placebo data from over 200 patients to actually evaluate a comparison of daily deflazacort and daily prednisone. And if we look at these trials, the 007 trial was conducted in patients greater than 5 years of age, the 020 study in patients 7 to 16 years of age, and the Lilly-Tadalafil trial was conducted in patients who were 7 to 14 years of age. The 6-minute walk test was the primary endpoint. There were also time function tests obtained, but we have actual placebo data on patients with daily corticosteroids in 30 patients from the 007 trial, from 84 patients from the 020 trial, from 85 patients from the Lilly-Tadalafil trial. Next slide. So again, the data we will focus on today is pooled studies focusing on key measures of physical function, the 6-minute walk distance, time to climb 4 stairs, descend 4 stairs, stand from supine, and the North Star ambulatory assessment. So again, these are all patients who were treated with either daily prednisone or daily deflazacort. Some of the previous meta-analyses also included patients who were on intermittent regimens of prednisone. Next slide. So in comparing these groups, very similar age groups among the prednisone treated and the deflazacort treated, similar anthropometric measures. The corticosteroid doses were actually very similar as a percent of the recommended initial corticosteroid dose. So 75.5% for the deflazacort treated patients in terms of their recommended deflazacort dose, 74% for the prednisone treated patients in terms of their recommended prednisone dose. And these patients were on average on these regimens for about 3 years duration. Next slide. So with regard to the 6-minute walk data outcomes, looking overall at the overall population, there was about a 33-meter treatment effect favoring deflazacort over the prednisone-treated group, statistically significant. If we could go to the next slide. Similarly, in the overall patients, there was overall improved function on time to climb 4 stairs by about 2.7 seconds and time to descend stairs by 2.2 seconds. Again, both statistically significant and a nearly significant effect favoring deflazacort for time to stand from supine. If we could go to the next slide. The linearized North Star score also showed better outcomes on the overall linearized North Star score by about 4 points for deflazacort treated patients in relation to prednisone treated patients. Again, statistically significant. Next slide. However, when we look at the subgroups of patients for baseline age, I think we had a large number of patients who were actually greater than 8 years of age, more so than those that were 4 to 8 years of age, and then fairly well-balanced groups in terms of those that were below 5 seconds and those that were greater than equal to 5 seconds. And similarly, fairly well-balanced groups in terms of those that were on the steroid regimens for 0 to 3 years versus those that were on the regimens for greater than 3 years. Next slide. So I think what is really quite interesting is when we look again at subgroups of patients, those who were 4 to 7 years of age actually showed really no differentiation in terms of those treated with prednisone versus those treated with deflazacort. But if we look at the older patients, those who are greater than or equal to 8 years of age, we see an even greater effect with regard to 6-minute walk distance. Similarly, those that have stand from supine times of greater than 5 seconds on the 6-minute walk distance, there was a greater treatment effect favoring deflazacort versus prednisone. And those that were on steroids for a longer period of time, greater than 3 years, show a greater deflazacort effect versus a prednisone effect. Next slide. Similarly, when we look at the time function test, you can see here differences in the data. This is the upper 3 bars show time to climb 4 stairs, and the red data point shows those that are greater than or equal to 8 years of age. The blue data point, those that are greater than 5 seconds on their time to rise, and the darker data point is the those that are on the steroid regimen for greater than 3 years. And again, we see very consistent benefits across really all 3 time function measures: time to climb 4 stairs, time to descend 4 stairs, and time to stand from supine, favoring deflazacort over prednisone in these more severely affected patients with Duchenne. If we go to the next slide, here's the patients that are the data from the patients who were 4 to 7 years of age. And here you see less of a clear distinction between deflazacort and prednisone, with no statistically significant differences really between the 2 regimens in those younger patients with lower stand from supine times, and also those patients that were on steroids for less than 3 years. Next slide. Similarly, with the North Star, we are seeing really fairly consistent results across the North Star, both for the younger patients as well as the older patients, and for the less progressed based on stand from supine time, as well as the those that were showed greater disease progression. But again, those that were on steroids for greater than 3 years, we see a greater treatment effect favoring deflazacort. Next slide. So I think these results confirm, at least in terms of efficacy, apparent benefits of daily deflazacort over daily prednisone. Patients on deflazacort perform better in the 6-minute walk test, time function test, and the North Star compared to those on prednisone. There were greater differences observed in patients who were older, greater than or equal to 8 years of age, had more advanced disease progression with stand from supine times of greater than or equal to 5 seconds, and those who were on steroids for greater than 3 years. So I think it's easier to see differences in patients with greater disease progression. And I think these results add to the growing body of evidence demonstrating the potential for cumulative benefit of deflazacort versus prednisone. Again, this study did not look at safety issues between the 2 regimens. And next slide. And with that, I'll end and back to you, Ryan. Thank you.
Great. Thank you so much, Craig. I think Eric has one follow-up question to end us off with.
Yeah, so just if you could maybe give us some insight. So you said, at about 3 years, you start to see some of that separation. About how early do we, after initiating steroids, do we start to see those differences between prednisone and deflazacort? Does it take until 3 years? Does it start showing up earlier, differences in the function?
Well, that's a great question. I think certainly, this was all 48-week data, and mean age was greater than 3 years of exposure. My sense is you probably certainly don't see those differences within perhaps the first year of administration, but there is a cumulative effect over time. I think one of the hypotheses is that prednisone is more fat soluble than deflazacort, and perhaps as the disease progresses and you get more fat fraction or more fatty infiltration into the muscle, perhaps more of the prednisone is taken up into the fat compartment, whereas deflazacort may be more bioavailable to muscle fibers. That's just one of the hypotheses, but a great question.
Oh, great. Well, thank you, Craig. We really appreciate you taking the time to share that data with us.